All right, good night, everybody. This is Jen coming to you from Fort Worth. So it's 8 o'clock Central Time here. Let me know where you're all joining in from, because I have many new friends from all over the country right now. So just would like to know where you're joining from this evening. And for some of you that are new to my page, my name's Jen. I have been a nurse for more than 20 years, have actually worked in healthcare for about 30 plus years now. So tonight's Facebook Live of Healthcare Hot Topics and Hot Topics in Healthcare is going to speak about gaslighting, medical gaslighting, so trigger warning for some talking about gaslighting, especially when it comes to getting medical care. This is a huge topic within the medical community and public. So that's why I wanted to come on here, talk about it. And I know this topic has been getting more and more traction lately, especially now, thankfully, with male doctors speaking up. That's kind of what it took, and is what I mean by medical gaslighting is sometimes when you go to the doctor and you know something is wrong with you. However, nobody is really listening to you or believing what the problem is. An example is a lot of times a doctor may tell a patient, it's all in your head. This could be whether it's depression, migraines. Well, migraines, it is in your head. However, this is when they're saying that a migraine is something controllable, that, the reason you have the migraine is something that you're doing wrong or that you don't want to get better. So that's what I mean when I say medical gaslighting. This happens a lot with people with chronic pain, where then medical doctors or healthcare providers may deem that patient and judge that patient as drug seeking, when that person may actually be in chronic pain and just looking for answers. This also happens especially when somebody unfortunately goes to the emergency room. And this is where medical professionals need to work together, because many people go to the emergency room because that's where their doctor told them to go. Always check with the hospital so many times, and I know this is frustrating for the patients and for the ER staff. Many family care providers, family doctors will tell somebody, oh, if this gets worse, go to the ED. Many times a patient will then just go to the ER and maybe expect to be seen. They think possibly that they're going to be directly admitted to the hospital because the doctor told them to go to the ER. And however, many times that's not the case. Many times, sometimes with chronic pain, that person earlier in the day, their pain, when they went to the doctor's office, their pain might have been horrible. Then in the evening, they go to the ER because the pain's still there, but it might not be as bad. So then the ER staff is looking at this patient like, well, we're not going to do all these tests. You need to go follow up on your own as an outpatient and get these tests done. That's what I mean by sometimes the medical gaslighting of providers also not believing their patients. And I know this is easier said than done. And I know places like the Joint Commission have made things worse with the opioid epidemic and all that, where hospitals get reimbursed for patient satisfaction scores, and pain's considered the fifth vital sign. So if somebody feels their pain is not in control, this has created a whole realm of things, of issues, where then patients thought, oh, I shouldn't ever have any pain. And so sometimes people with chronic pain, they're still going to have some pain. I'm not saying that they deserve to have excruciating pain where they can't get up out of bed, nothing like that. But sometimes people with chronic pain are going to have pain, unfortunately, or somebody that has chronic migraines, they might always have those migraines, unfortunately, but there are meds or some things that they can do that might alleviate some of the symptoms, not all of the symptoms. And many times with chronic pain, a lot of patients get medically gaslit of them not being believed. And this is also true with those with like mental health disorders, of anxiety and depression, where they're told, oh, it's just in your head. Well, yeah, it's depression and anxiety, but where they're not believing the person. And with certain mental health issues such as anxiety and depression, you do and can have somatic symptoms which can, if you have chronic pain, then make the chronic pain worse. Because what came first? The pain or the anxiety and depression? And sometimes people have had car accidents and now all of a sudden they're in pain, and that pain has caused more anxiety and depression, or the anxiety and depression can then cause sometimes chronic pain. And this is where many healthcare providers unfortunately don't listen to their patients, or just rub it off, as, oh, that's this, and not really give them the time of day, which is really sad. And I'm here to help fix the broken healthcare system. Like we saw with COVID, like our healthcare system is messed up, it's broken. And thankfully, with this platform, having a seat on the table, sharing my experiences, I can help others try to navigate this, because I know it's not easy, even for myself with this many years, 20 plus years experience in healthcare and nursing, that it can be a pain and very hard and difficult to navigate. It has nothing to do with how educated you are, because many times just looking at your healthcare benefits, that and getting sure that those are all correct, and calling the insurance company, which we all know is the biggest pain in the butt. However, sometimes we just have to do it, as one of those things as being adult just have to do, unfortunately, to figure those things out so you don't have a huge medical bill that you were not expecting. And also with the medical gaslighting, it is actually worse for females. A lot of medical doctors on social media are just now discovering this. But I am glad it's being talked about. I am really glad that it is now being taken seriously. Some examples: if a man has a vasectomy, doctor writes him off, work a couple days, whatever, gives him pain medicine, go home. Women who have IUDs replaced, or cervical biopsies, or having IUDs taken out, and other type of biopsies in certain areas, they're not given any pain meds prior, during, after, nothing. And so this has become, especially with GYN procedures for females, where they're not getting any type of medication for these services and procedures. I know one procedure I had several years ago, I was given the offer to have it under local anesthesia, and I was like, oh yeah, I know somebody else, due to their insurance, that they were kind of tucked into having this procedure as actually an outpatient procedure in the office. And I was like, oh my God, I don't know how this woman did it. I couldn't have done that. I was like, no, you're going to put me under. I was out when I got my wisdom teeth out, because I had an extra one. So I was like, these coming out, we going to do I'm going under the IV sedation. I don't care. I don't want to feel the pain. And so this is a lot of times what women have to deal with, and some things that they just say, oh, it's because you're a woman, such as things like PMS, cramps, all those things, perimenopause, menopause, where they're all symptoms. And sometimes, the doctors are like, oh, it's in your head. And now they're actually realizing that it's not, and somebody said that they're actual physical symptoms that can help be alleviated and relief for. And now they're finally realizing within the past several years that this has come out, that sometimes women have different symptoms when they are having a heart attack than men. However, many, many times when it's a woman having these symptoms, they are told it's anxiety. They are told, oh, it's just, gastritis, an upset stomach, your diet. They're really, unfortunately, not taken seriously. And then also, if we look at how women are treated during childbirth, as the U.S. and certain states in the U.S. have the highest infant mortality rates, because women are not believed when it's coming to complications of their pregnancy or something wrong with their child. And with the infant mortality rate, is what that means is a child not making it from birth to 1 year old. And for a developed nation as the United States, of not listening to women when they're in distress, especially with something like pregnancy and the complications that come with that. So thankfully, a lot more people now are speaking up against this and out about this, which is great. So I just want to teach you all to advocate for yourselves when it comes to going to your provider. A couple things you can do to make the appointments easier for yourself is have all your medications written down before you go to your appointment. Make sure you have all your medications written down, the dosages, how many times a day, and also have written out what you want to talk to the doctor about. Are you there for a follow-up from lab results? If that's that, what are the lab results? What does it mean? What follow-up testing do you need? Where do we go from here? And if you're having any new symptoms, also make sure you're bringing those up as well. Because the other medical gaslighting that happens is somebody can have multiple things going on with them. Like somebody can have cancer. Somebody can also have, that same person can have high blood pressure, hypertension. It's not saying that the cancer caused the hypertension or the hypertension caused the cancer, but then, the cancer doctor, oncologist, so the cardiologist is like, oh, well, that's not my field. But then the cardiologist is like, well, if they're on the, chemotherapy drugs, I want to make sure what I given them is not going to interact, and nobody's really talking to the patient and doing what's best for the patients. And that's really sad, because then the patients get lost in the medical system and they don't follow up. One, because the instructions are so confusing and they get frustrated. So make sure you just have those questions written and that you're getting the answers that you need. And sometimes if you bring somebody with you to the appointment that you feel comfortable with, or another option is sometimes if your loved one can't go to the appointment with you, where that person, with your permission, can maybe you call them and FaceTime with the physician for your loved one to be asking those type of questions. Because I know a lot of times when you go to the doctor, you have this list in your mind of all the things you feel you need to say, need to get answers to. And then they walk in and then you just forget what questions that you had. I mean, it happens, but this way you're, protecting your time and resources, because it's really hard to get doctor's appointments and you've probably drove there, waited. So that way you can use your time effectively. And you are allowed, if you're not getting the answers you need, you are allowed to get second opinions. You're also allowed, if your services get denied, you're also able to appeal that. And I will do a whole nother video on that. But with this medical gaslighting, it's unfortunately harder on women than it is in men, but also men who deal with post-traumatic stress disorder, pain, mental health issues. For them, they're also brushed off of just oh, this is just in your head, or if you're having pain. And you can have pain and still have anxiety and depression, but nobody's concentrating on, okay, well, what's causing this pain? And it's not always in the head. And yes, there's going to be a lot of people on here that's oh, gut health, gut health, gut health. You can still have these issues with the best gut health, with the best, your back being completely aligned by the chiropractor. You can still have these issues. And sometimes it's where you have multiple issues. And that's where sometimes even more medical gaslighting comes on, because the doctors are well, this person went to this doctor and this doctor. How come they can't find out what's wrong with them? And I speak from experience. I had my own experience having migraine headaches, have had them for years. Thankfully, they've gotten a lot better. There's certain things that I can control with the migraines. I can only control myself, control what I do, control what I put into my body. Certain things, especially in the heat, for me to stay hydrated, drinking water, taking a water bottle with me, especially yesterday with traffic and a bad accident, got stuck in some nasty traffic due to a car accident that just delayed everybody's traffic. So I was stuck in traffic for about good 3 hours. Thankfully, I had my water with me, being in the Texas heat. So also for me, staying on a schedule really helps. Not staying up all night, watching movies, where it's, fun with my friends and game night. But then the next day I'm kind of paying for it. As certain things also, like I said, what I put in my body is I have to be very careful with drinking alcohol. Yes, I like a glass of wine every now and then. However, sometimes certain alcohol may just depends on the brand or whatever, may cause a migraine for me after a couple sips. So I have to be careful with that. But those are really the only things I can control. I can't control the barometric pressure that can cause a migraine. I can't control the heat, the temperature of the heat that may cause a headache from heat exhaustion from just being out in the heat for a little bit. Those are things outside of my control. Also, when it comes to stress, some external stress I can't control, but stress that I put on myself is something that I can control. So I'm very careful with that, of what stress that I just acknowledge, because a lot of things I'm this is not mine, put it down, let them be, let it go. Because sometimes that extra stress and me worrying about something is not worth my physical or mental health, going down the rabbit hole, just for something that's completely out of my control. But like I said, I can't control the weather. I can't control if other people are wearing perfumes or smoking or something like that. I can't control that. I can just control what I do. So those are things I do to, help alleviate my migraines. However, yeah, I still have them. They've gotten better, but I had to go to family doctor, cardiologist, neurologist, had a bunch of different tests, had different lumbar punctures, had the MRIs, CAT scans numerous times over the years. However, then they're some of them, it's we're kind of putting it off. I wanted to be on opioids or something like that, which actually make your migraines worse because you can get a rebound headache. So I'm like, why would I want that? I want to be functional. I don't want these migraines at all. I want to be functional. And so then there was a lot of that, I had doctors you just want to be sick. No, I'm a nurse. I work full time. I've got bills to pay. No, I don't want to be sick. And no, I don't want anybody taking care of me. So that was another hard thing, was then asking for help when I needed help when I was sick. And then some of the other things was seeing cardiologist, where some of medications I just really couldn't take because I had low blood pressure. And that would just have made me even worse, and sometimes it did. And then finally, they found out after years of finally going to a specialty hospital several years ago, that they found out the migraines were basically just caused by low blood pressure. Yes, again, there was a pill that they could give me, a medication. However, this medication had side effects that increased my pulse and made my heart rate too fast. So then it was one of those things what do you do? And thankfully, I'm glad that I advocated for myself to get the answers. And I just kept fighting and fighting and fighting, and eventually got those answers. I actually got new doctors, because if those doctors weren't listening to me, then they really weren't advocating for me. And I had to learn in that process to advocate for myself. It's okay to fire your doctors. Maybe not when you're in the hospital, but with those you follow up with, if it's not a good fit, you can get another doctor. Just like if you're seeing a psychiatrist or a therapist, if it's not a good fit, you can find another one. Now, will it take a while? Yes. So you want to make sure you're looking for one, and then that, physician is willing to take you on as a patient. I'm not just saying just stop treatment. That's not what I'm saying at all. However, if you know it's not a good fit, it's going to be in your best interest to find somebody that is listening to you, that is advocating for you. And that's the best you can do, is just keep advocating for yourself and don't give up. And yes, it is frustrating. It is so frustrating. And I know sometimes going to the doctor, you're not going to get all the answers in one visit. And yes, will it require follow-up visits? Yes. But then there comes a time of, okay, we've had all these follow-up visits. Where do we go from here? Because this is not working. And so you need to be asking yourself, and the doctor's like, okay, this isn't working. What can we do? What can I do? What's working? When I was having my migraines, one of the things I did was they had me keep a log. And then eventually I stopped it, because I did keep a log just so, when I had the migraines, what activities I was doing, rate the pain. I did that. And then also what foods I was eating, sleep, when I woke up, when I went to bed, how often was, I working, all that stuff. And really some of the stuff really had no correlation, no causation. So I was like, nope, not wasting my time doing any of this. So sometimes your doctors may do that, and that is something you could do prior going to your doctor's office, to the doctor's appointment, is, showing them a journal, whether, it's high blood pressure or you're diabetic, if your, blood sugars are too high, too low, what foods are you eating, what activities were you doing before, the blood pressure was too high, too low, for your blood glucose readings, whatever that is. And if it's pain, like keep a log of like, okay, it hurts more in the morning, right when I wake up, or it hurts after maybe this activity. So then you guys can kind of pinpoint maybe what time of the day it is. Maybe if you have an office job, maybe it's because you're just sitting too long. All those things where to you it might not be a big deal, but it could be something of, okay, well, maybe this is what's causing it. So they have some sort of starting point. So I just encourage you to keep advocating for yourselves and keep your doctor's appointments. It is okay to ask questions, to seek second opinions, and sometimes seek other doctors. I know it's hard. I had to do this, and I even did it. One of the places I worked as a nurse, I did not get along with the one neurologist. That neurologist thankfully rarely ever came to our hospital, but he was covering for actually my neurologist. And I was like, nope, I don't want you. And I made sure I called my family doctor to get my family doctor. And this was a couple years ago when your family doctors actually went to the hospital and you didn't have the hospital list. And I know that has changed and changed some. And also keep a log of all your doctor's appointments, who you spoke to. So that way, if you go to a new doctor or have that follow-up appointment, that the other doctor knows what's going on. Because sometimes you might have a follow-up appointment with a doctor at the same practice, and maybe that doctor had a family emergency or something came up where that doctor could not be there that day. And this will give, that doctor that's covering more of an idea of what's going on, of, hey, did this work? Or, and the symptoms getting better, or are the symptoms of X, Y, and Z getting worse? So I just want to come on here tonight and hop on and just talk about that of healthcare hot topics and hot topics in healthcare when it comes to medical gaslighting, and just ways for you to advocate for yourself. If you have any questions, please just list them below. Thank you for tuning in tonight. I'll see you all next week. Stay cool and hydrated, and I will see you all next week.